Sexual health is an integral part of life, and that doesn't change when you turn 60. Did you know that having an honest conversation with your doctor can help you enjoy a safer, healthier, and more fulfilling sex life? In the United States, where seniors are increasingly open about love and intimacy, regular sexual health checkups are becoming an important step in protecting yourself and your partner. However, many older adults are hesitant to discuss the topic, leaving potential issues unresolved. On the Senior Health YouTube channel, we explore why seniors should talk to their doctors about sexual health, the benefits of regular checkups, and how to overcome shyness to prioritize your health. Learn how to live a full and confident life at every stage of your life. Seniors in the United States are experiencing a significant shift in how they view sex. According to a study from the National Institutes of Health, more than 50% of people over the age of 60 are sexually active, and that number increases as couples or individuals seek new relationships following divorce or the loss of a spouse. The rise of dating apps like Our Time and senior communities has opened up opportunities for people to connect and explore love at this age. However, with this openness comes health risks that not everyone is fully aware of. Sexually transmitted diseases, STDs such as chlamydia, gonorrhea, syphilis, and HIV, are on the rise among older adults, with the Centers for Disease Control and Prevention, CDC, reporting that STD rates in this age group have doubled over the past decade. Additionally, problems like erectile dysfunction, vaginal dryness, or decreased libido can be signs of underlying health conditions that need attention. So why is sexual health screening important for seniors? First, it helps detect problems early that can affect your sex life and overall health. Many conditions, such as STDs or hormonal problems, do not have obvious symptoms in their early stages, especially in older adults, where the signs can be mistaken for age-related problems, such as joint pain or fatigue. For example, chlamydia and gonorrhea may not cause symptoms, but if left untreated, they can lead to serious infections or organ damage. Similarly, HIV, if not diagnosed early, can weaken the immune system, which is especially dangerous in seniors because natural immunity decreases with age. A simple test, such as a blood or urine test, can detect these problems and allow for prompt treatment, helping you avoid long-term complications. Second, a sexual health checkup offers an opportunity to address issues that affect intimacy. Erectile dysfunction, a common problem in older men, can be a sign of heart disease, diabetes, or low testosterone levels. Similarly, vaginal dryness or pain during sex in women can be related to postmenopausal hormone changes or conditions such as urinary tract infections. Your doctor can recommend treatments, from medications such as sildenafil Viagra for men to hormone therapy or lubricants for women to improve sexual comfort and pleasure. Additionally, psychological issues such as depression or anxiety can also reduce desire, and a doctor can refer you to a therapist or prescribe appropriate medications to support your mental health. Another benefit of sexual health screening is prevention. Your doctor can provide information about protective measures, such as using condoms to prevent STDs or vaccinations for diseases like HPV or hepatitis B, which are still effective in older adults. They can also advise on strategies to maintain sexual health, such as exercising to improve circulation or making lifestyle changes to manage chronic conditions. In the United States, health services like Planned Parenthood or community clinics often offer free or low-cost testing and counseling, making it easier for older adults to access sexual health care without financial worries. However, one of the biggest barriers to getting a sexual health checkup for older adults is shyness or embarrassment. Many people grew up in a time when discussing sex was considered taboo, and they may feel uncomfortable talking about their sex lives with their doctors. Some worry that their doctors will judge them, or that sex is no longer important at their age. In fact, doctors today are trained to handle these conversations sensitively and professionally. In the United States, organizations like the American Medical Association encourage doctors to proactively discuss sexual health with older patients, recognizing that it is an essential part of comprehensive care. If you find it difficult to get started, choose a doctor you trust or request a private consultation to feel more comfortable. How to prepare for a sexual health exam. First, make a list of your concerns, such as changes in desire, difficulty with intercourse, or any unusual symptoms, such as discharge or pain. Make a list of medications you are taking, as some, such as blood pressure medications or antidepressants, can affect sexual function. If you have a partner, consider discussing whether you both want to be tested together, especially if you are in a new relationship. When you see your doctor, be straightforward, but there is no need to go into personal details if you are uncomfortable. A simple statement, like "I want to get my sexual health checked," is enough to start the conversation. Your doctor may recommend additional tests, physical exams, or counseling based on your needs. For seniors in new relationships, sexual health screenings are especially important. The rise of dating apps and senior living communities in the United States has created many opportunities to find love, but it has also increased the risk of STDs. Before engaging in sexual activity with a new partner, make sure you've both been tested and openly discuss your sexual health history. This not only protects your health, but also builds trust in the relationship. If you find it difficult to broach the subject, try saying something gentle, such as "I'd like us to get tested together so we can both be at peace." This honesty can deepen your connection and show that you value each other's health. Seniors living in nursing homes or assisted living facilities also need to pay attention to their sexual health. These environments often facilitate new relationships, but they can also increase the risk of STDs if precautions are not taken. Some facilities in the United States have begun offering sexual health education programs, including counseling and testing, to support residents. If you live in such a community, ask the management team about available services or contact a local clinic. Organizations such as the American Association on Aging AARP also offer online resources on sexual health that can help you better understand the steps you should take. In addition to regular checkups, seniors can support their sexual health through a healthy lifestyle. Regular exercise, such as walking, yoga, or swimming, improves blood flow and increases energy, both of which are important for sexual function. A balanced diet, rich in fruits, vegetables, and healthy fats, can help control chronic conditions and support hormone health. Staying hydrated and getting enough sleep also contribute to comfort and desire. If you are taking medication, ask your doctor about side effects that may affect your sex life and consider alternatives if needed. For example, some blood pressure medications are less likely to cause erectile dysfunction than others, and your doctor may be able to adjust your dosage to reduce the impact. Mental health also plays a role in your sex life. Depression, anxiety, or stress can reduce your desire and make it difficult to connect with your partner. If you are struggling with these issues, consider talking to a therapist or joining a senior support group. In the U.S., services like BetterHelp or community centers often offer affordable online or in-person counseling. Relaxation techniques, like meditation or mindfulness, can also help you feel calmer and more open to intimacy. If your partner is struggling, encourage them to seek support and work together to build a healthy relationship. Ultimately, remember that sexual health is about more than avoiding disease. It's about enjoying the joy and connection that sex brings. A conversation with your doctor can open the door to solutions that will help you feel more confident and comfortable in your sex life. Whether you're in a long-term relationship or exploring new love, prioritizing your sexual health is a way to honor yourself and your life. The Senior Health YouTube channel hopes this article has inspired you to take the first step, make an appointment with your doctor, and start the conversation about sexual health. Leave a comment, share this video with your friends, and subscribe to the channel for more helpful tips for living after 60. Together, we can build a community of healthy, confident, and vibrant seniors.